Okay, so let's switch to efficacy. I think the vivisectors can correct me on this, but my understanding is that their argument is that the ends justify the means, is pretty much it, ethically. That we are doing this in order to improve the health of our own species, and therefore the monkeys are just kind of screwed. Or we are doing this just to advance our knowledge base. Knowledge is good, science is good. I'm a scientist myself. I've got lots of publications. I do science. I'm a huge fan of science. And so some of the vivisectors would say, well, we're doing this to increase our knowledge about the neural control of eye movement during smooth visual pursuit and the vestibulo-ocular reflex. Is that fair? Yes. Is that true? Yes. They are doing that. They are accomplishing that. It is good science. And then the question is, but look at the cost to that monkey. And they would say things like, well, it's a sacrifice we're willing to make. But that's because they're like-minded people in groups. I think if you were to get a sample of Wisconsin citizens and ask them, is it worth it to learn yet more? These experiments have been going on for 30 years about visual pursuit and vestibulo-ocular reflex. Maybe the people of Madison would disagree with that. But the like-minded people in groups are influenced by that phenomenon that they skew to the extreme position where pretty much anything goes. But okay, be fair. It does increase our scientific knowledge. And then does doing this to Frick advance the health of our own species? Well, that's interesting. Another one of the strangest things vivisectors say is I've published on this at the Chronicle of Higher Education, and one of the kind of irate letters I got back from a vivisector, because I was saying how this has nothing to do with Alzheimer's disease, he said, Dr. Hansen cannot possibly know that it is beyond the realm of possibility that someday, somehow, this will affect human health. I was saying, well, you got me. I mean, it's pretty damn hard to prove anything is beyond the realm of possibility that someday, somehow. And what that means is, for them, anything goes. Because nothing is beyond the realm of possibility that someday, somehow. But I would suggest that if you're not in that like-minded group of people skewed over to the left, before you would allow this much pain and suffering, you'd want a more direct connection to how it's going to help people. And even then, some people would say it's not worth it. Opinions would vary as to whether the ends justify the means. And what I have found, at least in this study, and I don't know if people in Wisconsin do this or not, and this is from the grant. This is from the grant when I first got involved. They said, this may allow us to find the cause and ultimately the cure for many diseases of learning and memory, such as Alzheimer's disease. Nothing to do with Alzheimer's disease. The monkeys don't get Alzheimer's disease. Alzheimer's disease does not affect the visual tracking system. Alzheimer's disease does not affect the vestibular nuclei. It doesn't affect the cerebellar flocculonodular lobe. It doesn't affect the oculomotor nuclei. Nothing to do with Alzheimer's disease. And I've been following them around for years now, making this point. And when the grant came up for renewal, perhaps I flatter myself, but I notice now, because it's been going on for 20 years, they took out the Alzheimer's disease. And no, the newest incarnation of the grant says it's going to shed light on the normal functions and pathways that are compromised in many strokes and motor disorders and potentially lead to new therapies for assisting recovery from strokes. Strokes? It's got less to do with strokes than it does with Alzheimer's disease. Strokes are all about blood flow. They're all about atherosclerosis, stenosis, thrombosis, ischemia, withholding blood, tissue death, infarction. I'm a stroke guy. I know at least as much about strokes as I do Alzheimer's disease. It has nothing to do with strokes or recovery from strokes. So why do they do this? I think that they do this in an attempt to deceive, although like-minded people in groups, if you hook them up to a lie detector, they would probably say, well, it's not beyond the realm of possibility that someday, somehow, this will have something to do with strokes. So I'm not telling a lie. One of the more honest responses, though, I got after I published that article was from somebody who does this kind of primate research. And he said, that's just grantsmanship. He goes, those of us who approve or disapprove primate research, we never pay any attention to whether it has any application to human disease. All we care about is it good science. So I got to respect the guy for his honesty. And I think that that's usually the case, is all they care about is good science. But they want to make you care about it, because I think most of you, or at least a lot of people I know, would say this is too high a price to make Frick pay to learn yet more about visual tracking and the vestibulo-ocular reflex. But I don't know, Grandma's getting kind of foggy, and if this will cure Alzheimer's disease, okay, Frick, you know, time to bolt your head in there. They're appealing to our fear and our selfishness. They're appealing to the worst aspect of us. They want us to throw all the other animals under the bus. And then this is another point I want to make. This drives me nuts. Is they do. It's dangerous to interrupt people when they're congratulating themselves, because when you pat yourself on the back and you're startled, you could dislocate a shoulder or an elbow. But they will say things like, "The sacrifice we're willing to make to improve the health of our own species," which is a noble motive. Everybody wants to improve human health. If that's really their motive, if their motive isn't just basic neuroscience, which I suspect it is, if their motive isn't advancing their research agenda or getting tenure or writing more papers or learning more about basic neuroscience, if their goal really is to improve the health of our human species, there are better ways to do it. In 2010, there were 10 million preventable deaths. People that died of diarrhea, which we can prevent, people that died of pneumonia, which we can prevent, we can treat and prevent. It turns out if you really want to improve the health of your species, putting the monkeys in the chair and bolting their heads in there is not a very cost-effective way to do it. If you really want to save millions of lives, and that's what they say is their motivation, I'll take them at their word to improve the health of the human species, let the monkeys go, and instead send soap to Pakistan. This was a study where they looked at what's the effect of hand washing on the prevalence of pneumonia and diarrhea in Pakistan. People didn't know to use soap. Turns out that if you teach them how to use soap, you cut the rates of diarrhea in half, so instead of 2 million kids, 1 million kids die. You cut the rates of pneumonia in half, so instead of 4 million kids, 2 million kids die. You save 3 million kids with soap. So if they're going to justify what they do based on improving the health of our own species, I think they are, to use another dog metaphor, barking up the wrong tree.